Hello, good morning. My name is Dr. Moise. So, I'm your physician today. May I know your name?
Yuri Dimitrovich.
Yuri Dimitrovich. Okay. How is your
70.
70? Okay. Where your address?
Lenina Street 90.
Lenina Street 90. And then, what is your occupation currently?
I'm a driver, taxi driver.
Taxi driver. And you're married?
Yes.
Okay. And your admission is today, right?
Mm-hmm.
Okay, thank you. Theory. Now I'm going to perform general inspection for you. I will start with general condition. Okay, you're in a satisfactory condition. And for the Glasgow Coma scale, I need to ask a few questions. Can you move your arm, please? Flex first. Okay. Tell me what day is today?
What day? Today is Tuesday, 15 June.
Okay. For the Glasgow Coma scale, I will give 15 for the point. Is alert. For the look on the patient face, it's exactly on the same age. Patient looks older from his actual age. And then for the posture, it is active, but this patient is limping because of his condition of his left extremity leg. So for the BMI, I already checked before, you got overweight of 0.26 because your weight is 85 and your height is 180 centimeter. So you have a hyperstenic constitution. So for the nutritional status, okay, you are well nourished, symmetrical state of development, and at the same time your skin is pale, no hemorrhage and no scar, and also no pigmentation. Okay, may I take your glasses off, please? Thank you, Mr. Yuri. Okay. Here's glasses. So for your, I inspect from your eye is a normal brightness, no exophthalmos, no endophthalmos, and you have a normal corneal state. Okay, Mr. Yuri. So for the body temperature, I already checked before, you got a normal body temperature, no fever, 37 degrees. Okay. Okay, Yuri, for the subjective examination, may I know what is your complaint?
I don't know why, because suddenly I have ulcer on my leg.
You have ulcer on your leg, okay. So, can you describe more about this thing?
At first, I have pain at night, and also the pain makes me cannot sleep.
You cannot sleep, okay, during night. Sure.
Yes, and also before this, during walking, I have pain also, but the duration is after I walk for 500 meters or 600 meters. Only then I start pain. But now, since 20 days ago, even I do nothing, the pain still have pain and doesn't disappear.
I see. So, may I know, do you like injured your foot before this?
No.
No. So the wound just appeared like that?
I don't know why. It suddenly.
When the wound appeared actually? Is it like 3 weeks ago? Something?
Yes.
Okay, sure.
Yes, 3 weeks ago.
So I need to know about your past health history. So do you have any gastric ulcer?
No.
No. Do you have any allergy?
No, I don't have.
Do you have any blood transfusion before?
Yes, but I can't remember when, but I think many years ago.
And do you smoke, Mr. Yuri?
One packet for 2 days. And I already smoked for almost 40 years.
Okay. Do you take any alcohol or drug?
Yes, I drink alcohol 3 times a week. Okay. And I have no drug abuse.
Okay. So, do you have your family health history, like your father or mother?
My parents have history of myocardial infarction, I think.
Yes. I see. Okay, your parents though. Okay. Do you have any diabetes mellitus?
Yes, I was diagnosed with diabetes mellitus around 5 years ago.
I see. Do you have any operations before?
Pardon?
Any operations?
Oh, no.
No. Tuberculosis, TB?
Also no.
Stroke?
Mm-hmm.
Okay. How about myocardial infarction? Do you have any of it?
Unfortunately, yes.
I see. So due to that, do you took any medicines for myocardial infarction?
Only nitroglycerin.
Nitroglycerin.
I only took it when I have pain.
Okay. Thank you, Mr. Yuri. Okay, Mr. Yuri. Now for the objective examination for respiratory system, I need you to open your shirt, okay?
Okay.
Okay. Thank you. Okay, Mr. Yuri, from the what I can see from the inspection, I can see you have a barrel form of chest, and then at the same time you have no deformities of chest wall, and then your thoracic respiration and respiration rate, I can see that it's a 20 per minute, and you have no dyspnea for it. At the same time, your rhythm is normal. Okay, thank you. Okay, Mr. Yuri, now I'm going to perform percussion for the respiratory system. Would you turn your back, please? Okay, thank you. So from the percussion, you had a band box sound, and at the same time, you have a clear and loud resonance sound. So we have a equally symmetrical at the both point, and then there's no pathologic sound in the local region. It is absent. Okay, thank you. Okay, Mr. Lee, now is for the palpation of respiratory system. May you turn your back, please? I want to check for the vocal parameters. Would you say 99?
Okay.
Okay.
99, 99, 99, 99.
Okay, thank you. So for the vocal parameters, it's decreased, and for the elasticity of the chest is also decreased. Thus, your chest rigidity is increasing. Okay, thank you. Okay, Mr. Yuri, now I'm going to perform auscultation. Okay. Okay, from the auscultation, there's a presence of wheezing, and then there's no crackle sound, and no crepitation, and the vascular respiration is decreasing. Okay. Okay, Miss Yuri, now I'm going to take your blood pressure. Okay. Okay, for the blood pressure, you are having isolated hypertension, which is 180/80. Okay, Mr. Yuri, now I'm going to perform auscultation for your cardiovascular system, okay? Okay, from the auscultation, I can see that you're having a traction apical systolic murmur on your systolic, and then there's no pericardial friction rub, and then your heart sound is irregular, clear loudness. Okay, thank you.
For the conclusion, we can conclude that the patient is having left ventricle hypertrophy. This is the enlargement and the thickening of the walls of the heart, which losing the elasticity and leads to the increase of pressure to the heart. Next is the arrhythmia. So this is the disorder of the electrical conduction impulses within the heart. And the last is the isolated hypertension. As we can see, the patient is having a blood pressure of 180/80.
Now I'm going to do GIT inspection towards my patient. So for this first part, I'm going to do palpation. This is light palpation. And now I'm going to do for the deep palpation. Do you feel any pain, Roxanne?
No.
And now I'm going to do ballot the kidney. Okay. For the second part, which is percussion. And last for the auscultation part.
For the conclusion of the digestive system, we can conclude that the patient is obese and the liver is enlarged due to the alcohol intake from the palpation.
On objective examination of the genitourinary system, everything is found to be normal. As a conclusion, there is no dysfunction of the genitourinary system. On objective examination of the nervous system, we discovered that the patient feels weakness of the left arm and the left leg, and also numbness in the left lower extremity. We may conclude that the weakness and numbness of the left extremities is caused by the stroke suffered by the patient 6 years ago.
Okay, Miss Ray. For the result, I think we need to make a surgery for your situation.
Okay, but can you please explain how is the surgery gonna be? How is the procedure of the surgery?
Okay, for the surgery, how it's going to carry out, I have a few management plan. We'll start with the aseptic technique first. So firstly, we need to prep, trapping and shave of your surgical site. And then for the anesthesia regional, it is in your spinal area. And then we're going to amputate your part, which is your foot on the left part, from the 3rd to 5th toes. And at the same time, after that, the wound will be closed by the primary suturing, and then we will dress the wound. So after the surgery, you will be put into the general ward, and during that time, your dressing will be changed daily by our nurses, and maybe after 2 weeks, if the wounds are going to be healed, then we can get into the primary intention. Okay?
Okay.
Okay, thank you, Mr. Yuri.
For the clinical signs of peripheral vascular system investigation, we need to consider a few parts. And yes, the first part is the localization. We can see the localization is located on the left lower extremity of the patient. And secondly, the color is cyanosis, yes, we can see from our inspection. But for the pulse presence, pulse volume, local temperature, numbness, regional sensitivity, paralysis, and capillary film time, also with regional blood pressure, we need to palpate from this. So for the pulse presence, there are absence of posterior tibia and dorsalis pedis pulse. And then for the local temperature, it's a very low temperature. And then for the numbness, it is located at the left lower extremity. For both regional and paralysis, it is normal. And for the capillary refilling time of the patient, it is 4 seconds. And for the regional blood pressure, from the beginning, we can say that patient is having a isolated hypertension with 180/80 millimeter mercury. And then for the muscle wasting, we can inspect that, yes, it is muscle wasting. And there's no tenderness for the palpation. And then we move on for the varicose veins. For the varicose veins, we can inspect there's no swelling and there's no hyperemia of the veins, but for the palpation, also there's no tenderness over the veins. And for the trophic ulcer, we can inspect on the locator of the dorsal surface from the third to fifth toes. And the type of healing is secondary healing. Also with the staging healing is also inflammation with the size of 3 to 4 centimeter, no discharge, and the shape is irregular. And there are also no hyperpigmentation, but it's around the wound. So it is untidy with the unintentional wound infected. From these two pictures, from the left side, we can see the patient is having a muscle wasting, and for the right side, which is of course the left lower extremity, the wound is located on the dorsal surface from third to fifth toes. Yes, the borders are regular, the skin around is pale, and the color of the base is black.
Upon investigation of the peripheral vascular system, we can conclude that the patient has unintentional secondary healing of wound in inflammation stage complicated by poor wound healing. The factors that contribute to the poor healing is decreased oxygen and perfusion to the healthy tissues around the wound. Wound ischemia occurs as a result of chronic arterial ischemia of the left femoral artery. To confirm the primary diagnosis, laboratory and instrumental investigation is carried out. The result shows that the bleeding time, clotting time, prothrombin time, APTT and INR values decreases and platelet count increases. This indicates that the patient has a high hemostasis system. On instrumental investigation, we discovered changes in certain vessels. There is left arterial stenosis and chronic left lower limb ischemia. Changes are also detected in the ECG, and the plain chest X-ray shows cardiac abnormalities which is caused by the previous myocardial infarction and atherosclerosis. For the final diagnosis, we can conclude that the patient has arterial blockage in the left lower extremity, left carotid artery stenosis, atherosclerosis, and chronic arterial ischemia of the second stage. This is the management plan for the patient. The treatment plan of the patient includes modification of risk factors and medical therapy targeted at symptoms. Modifications of risk factors involves weight reduction, smoking cessation, improved diet, regular exercise, controlling of diabetes mellitus and hypertension, as well as dyslipidemia management. Medical therapy involves administration of vasodilators and antiplatelet drugs for prophylaxis of myocardial infarction, claudication treatment with pentosyphylline, and treatment of myocardial infarction with nitroglycerin.